I guess I also have to admit that another reason that I'm particularly interested in this is that both of my children have this problem, an unfortunate gift that I appear to have given them. Well, the fact is, it's pretty clear that migraine is passed down in families. Although it doesn't have the classical, simple genetics that many of genetic disorders that we know about have, it's pretty clear that if you have one parent, there's a better than even chance that somebody else among the children is going to have the problem. We were unlucky in my family. Both of my kids suffer from it and have had recurrent attacks. My son, at the age of 11, missed about 60 days of school in the last quarter of the 6th grade. And so I know firsthand what it's like to have a family member, to have it myself. And then I'm reminded every day at work how much people suffer from it. And a recurrent theme is the fact that, oh, my mom had this too, or my grandmother had this. That might be a clue as to how we can come to terms with this problem. Over the past 10 years, there's been an explosion in the techniques that allow us to better understand genetics and so-called genomic effects of our blueprint that everyone carries in every cell of their body. And I'm hoping that we'll be able to apply this increasing knowledge of genomics to migraine. In order to change the state of affairs that we find ourselves in, that I talked about a couple of minutes ago, at the Mayo Clinic, we began trying to establish what I call a migraine genomic library. What that means is that among patients and among willing volunteers in the community and among employees here at Mayo Clinic, we've begun to ask them to provide us detailed information about their migraine, when it started, what the attacks are like, what they've responded to, and we've also asked them to give us a sample of their DNA. In doing this, we're trying to get a large number of people that we understand the details of their migraine, but we also have a sample of their DNA. The hope is that if we compare a large number of people who have migraine, their DNA to the DNA of a large number of people who have never had a migraine in their life and whose parents and siblings don't have a migraine, that we might be able to come up with the differences that exist in the genome of people who have migraine compared to those who don't.